Hello guys, welcome to another video on Healthy Talkie YouTube channel. In today's video, we are going to learn about treating an enlarged prostate. Before we get started with the video, check the link in the description box below to discover the secret formula we recommend if you want to be free from enlarged prostate. Quick advice, make sure you watch this video to the end to get the most value from it. Let's start with today's video without wasting too much of your time. It's not just annoying to have a big prostate. It can also make you look bad. Even worse, the condition can lead to problems that are dangerous to life. If you think you've emptied your bladder but there are still a few ounces of urine left, you could have acute urinary retention. That means that you could have to go to the bathroom and not be able to because you are on a train, an airplane, a mountain, a remote highway, or scuba diving off a tropical island hours away from help. The urge to go to the bathroom gets stronger and hurts more until you have to be rushed to the nearest hospital, where a catheter must be put into the bladder through the penis to let the urine out. What can you do to stop that from happening? How do you treat benign prostatic hyperplasia, BPH? In the past, people with BPH or an enlarged prostate had only one choice: surgery. This procedure, called transurethral prostate resection, TURP, removes small pieces of the enlarged prostate that are blocking the flow of urine. A tiny tool called a resectoscope or operating cystoscope with a light and an electric cutting tool at the end is used to do a TURP. The instrument is put into the urethra, which is the tube through which urine flows. A small telescope lets the urologist see the area and cut pieces of the prostate gland. After the surgery, the resectoscope is taken out and a catheter is put into the bladder through the urethra. The catheter stays in the bladder for a day or two so that the bladder can empty while the enlarged channel heals. Dr. David E. Larson, editor-in-chief of the Mayo Clinic Family Health Book, says that most hospital stays last about a week. Most of the time, TURP gets rid of the painful symptoms of BPH, but there are a few problems. First, the prostate could get bigger again, which would require another surgery. This is true for 1 out of every 5 men who may need a second TURP procedure in the next 5 years. Second, surgery doesn't make people live longer. One study suggests that it takes a year off of a person's life. In rare cases, TURP can leave a person unable to urinate or unable to control when they urinate. The most common side effect, though, is retrograde ejaculation, which means that the semen that is ejaculated instead of shooting out of the penis and into the bladder. This could make a man less fertile. Men who have had a TURP don't lose their desire to be sexual, and they can still get erections, have sexual relations, and ejaculate. Unfortunately, the surgery could damage the internal bladder sphincter, which is the valve that allows sperm to flow forward. Dr. Richard F. Spark, an associate clinical professor of medicine at Harvard Medical School and author of Male Sexual Health, A Couple's Guide, says that when the bladder sphincter is damaged, it can't close before ejaculation. This means that the sperm flows backwards into the bladder. If you have tried all these tips and still suffering from enlarged prostate, then check out the secret formula we recommend. This is an all-natural supplement that you can use to achieve your desired results and be free. It is easy to take, very effective, and highly recommended. Learn more about our secret formula from the link below this video in the description box and find out how it can help you to get rid of enlarged prostate. Thanks for watching this video and don't forget to like, comment, and subscribe to this channel. The videos on your screen right now are also educative and informative, so make sure you watch them too. Live a healthy life, stay strong.